More than 500 million people all over the world are affected by osteoarthritis or OA as of now. So doctor, can you tell me something about OA or osteoarthritis?
Osteoarthritis means it's a inflammation of the knee bone joints actually. Okay. So it can affect your knee joints or lumbar joints as for example your cervical joints. It can hip joints. So it can affect any joints in your body. So simply it's an inflammation of the joints. It is happening because of our degeneration of the bones. The degeneration happening because of our aging. So that is the primary reason.
Okay.
So apart from aging, trauma can affect your joints.
Injury, right?
Injury can affect your joints. Then obesity or overweight can affect your joints because the knee joint is a weight-bearing joints. So if you are obese or overweight, then it will give you over stress to your knee joints. So all these things will cause the osteoarthritis of the knee. So this is in modern aspect. When you come to Siddha aspect, for example, again they are telling about the aging. So it is a natural process. Then they are also telling you if you take too much of Vada foodstuffs, that is food items which will increase the Vada humor. For example, plantain, that is a unripe banana, then potato, then pulse varieties like channa. So all these food items also will cause your knee joint arthritis. Okay. So this is the reason or etiology or reasons from the Siddha aspect. Okay. Then when you come to signs and symptoms, see it is a simply you can explain that you have pain in your knee joints first thing. Then there is a swelling in your knee joints. Then when you wake up in the morning, there will be a stiffness in your joints.
Okay.
Then if your inflammation is severe or swelling or arthritis is severe, what will happen? You cannot move your joints freely. That means there is a restriction in your movement.
There will be sound also.
That is called a crackling sound. So when you flex or extension of during the joints, there will be a sound arising. That is called a crackling sounds.
Okay.
So it's happening because of there is a degeneration of the cartilage. So cartilage is a tissue-like structure which will act as a
lubricant,
shock absorber between the two bones.
Okay.
So when the cartilage degenerated, the bones are rubbing on each other. So that will cause the degeneration of the bones again. Then that will cause the pain. Then again it will cause that sounds, crackling sounds.
Okay.
So these are the signs and symptoms of the osteoarthritis of the knee.
Okay. Doctor, can you tell me about the Ayurvedic approach?
Yeah, according to Ayurveda, Acharyas have mentioned this as osteoarthritis under the term Santigiri Vada or Janishula or Janishobha, we can say. So many causes are said, like ayasa, overexertion of the knee joint, adivyayama, over-exercise, then obesity is one of the cause, and so many causes are said. And this line of treatment, coming to the line of treatment, first we have to reduce, if the inflammation is there, first we have to reduce the inflammation. So we have to apply some lepas or some special preparation called dhanyamla is there. Dhanyamla dhara has to be done. Then we will come to the snehana type of treatment. Snehana means oilation. Applying oil in the knee joint. Abhyanga, local abhyanga can be done. And we have a special type of treatment called piju, local application of oil, hot oil using some cotton pads. That's a very good treatment for osteoarthritis. And we can prevent the further degeneration by using a treatment called Januvasti. Januvasti means first we are making pooling the oil in that knee joint. That's also a very good treatment. The aim of the treatment first is to reduce the swelling, then increase the mobility, reduce the pain, everything, and to halt the progress of the disease. That's also main aim of Ayurvedic treatment.
Okay, what internal medications do you recommend?
Yeah, so many kashayas, adishtas are prescribed in Ayurveda, like Rasna Saptakam Kashayam, Rasna Erandadi Kashayam, Gugulu Tiktagam, Indugandha Ghratam, Deshmula Arishnam, and so many rasayanas also mentioned in Ayurveda for the treatment of osteoarthritis.
Okay. Doctor, what about the Siddha management?
As per Siddha, actually it is happening because of the Vada humor rising. So first we have to reduce the Vada humor. Okay. So for that you have to give the purgation to the patient. Then you can start the treatment. So as already said in Ayurveda, there is you can use churanas, or pashpams, or chendurams. All these things you can use internally. Then externally you can apply oils. Then you can also use poultice. that is a pasting. Paste. So that is called poultice. So then you can also apply varmam. So varmam is like a technique like a pressure. So if you giving pressure to a particular points, then your pain will get relieved. So these are the treatment methods available for osteoarthritis of knee. The main thing is you cannot permanently cure the disease. So because of the aging, already I told, because of the aging, the bones are getting degenerated. So you cannot regenerate the bones, but you can manage the pains lifelong. Okay, then if it is more severe and if you are not satisfying with all these conditions, then you can go for the joint replacement. Okay. Usually most of them are not doing that. Most of them are satisfying with the treatment with Siddha or Ayurveda. Then another thing is the diet restrictions. Already I told, if you during the for example, if you are having or if you are suffering from the osteoarthritis, osteoarthritis of knee or osteoarthritis of any bone,
As a whole,
if you are taking this kind of food items like plantain or potato or pulses items, so or any cold items, so all these things will aggravate your pain. So you have to avoid all these food items also.
Yeah, the main aim is to reduce the vada, vatana. Reduce the vada. Diet and lifestyle should be to reduce the vada.
Earlier detection and management will let you move more freely and happily.